This is a scalpel holder, and it's used to just make the scalpel easier to hold and use. It gets inserted into there, and it just gives more of a handle, basically. Yeah. These are Mayo scissors. They're used for suture cutting and also cutting through tissue. These are rat-toothed forceps. They're used for holding dense tissue. And I don't know if you can see, but they've got kind of like rat teeth on the end, versus these are the normal forceps. These are towel clamps. They're used for holding the surgical drape in place during the surgery. These are curved hemostats. They're used for clamping a difficult to reach artery. These are straight hemostats. They're used for clamping off arteries, but when they're in a more accessible place versus the clamped hemostat, which can kind of reach under and get into hard to reach places. So these are just for easy to reach places. These are Alice tissue forceps. They're used to hold heavy tissue. This is a spade hook. It is used to help find the uterus while doing a spade. This is a lap sponge used for abdominal surgery for soaking up blood or saline. It can absorb 20 milliliters, so you make sure that they're not losing too much blood during an abdominal surgery by knowing specifically how many of these you've used. This is a surgical drape. It is used so that only the surgical site is exposed, and so that nowhere else is touched and there's no cross-contamination from anything. Like, this is to protect basically from stuff falling in, so that there's only that area, and it isolates it so it's easier for the surgeon to see where they're operating. These are swabs. There is 20 here, which I've counted out and checked. It is 20 per pack, and these are used for soaking up blood or other fluids such as saline, but not during abdominal surgery. We use these for abdominal surgery because they're more accurate. They can only absorb a set amount, so you know how much blood is lost, and abdominal surgeries are more risky for blood loss. So these are just for general surgery.